Even before the devastating 2010 earthquake, Haiti's people struggled to survive in a country ridden with challenges and injustices.
Joblessness is 70%, illiteracy is 70%, average annual income is about $1 a day. There's open sewers, sanitation non-existent. So all of the health problems that come with that kind of poverty, gastroenteritis, worms, parasites, amoebas, they're all rampant here. Sicknesses that come from living in close quarters are rampant here. Most people don't live to be 50 years old. And half the deaths in the country every day are children under 5. Half the deaths. We see severe suffering in children, severe.
In a country where hundreds die each day from curable diseases, St. Damien Pediatric Hospital is proud to have cared for more than 500,000 suffering children since it began in 1987. It moved operations to a new state-of-the-art 75,000 square foot facility in 2006, quickly earning the reputation of being Haiti's premier children's hospital.
We have a huge outpatient department so that we're not disturbing the economy of the family, because when a child's in the hospital, the mother is in the hospital. When the mother's in the hospital, 6 other children aren't eating, and she can't do whatever work she can find to do to have some kind of an income, and everything falls down. If the children have to come in, then we have general wards, infectious disease, non-infectious disease, program for malnourished children, for children with tuberculosis. Those are huge problems.
But when the earthquake struck, followed by a cholera epidemic later that year, all of Haiti's problems compounded exponentially. So did the need for care. St. Damien had no choice but to respond, and the number of patients served each year jumped from 30,000 to 80,000.
The first huge change in the hospital is the maternity and the neonatology programs, which started because places that had those programs were crushed in the earthquake. So we tried in a small way to start receiving women with problem pregnancies, diabetes, hypertension, preeclampsia, in order to help them through to the end. And then, of course, once the child is born, very often premature, then you have to start neonatology. The cancer program also has taken a boost for the same reason. But in the absence of other centers, our own cancer program has enlarged.
The surgery program also had to expand.
And we've taken advantage of different surgeons that were here during the earthquake time to form rotations of volunteer surgeons.
The public health and HIV program has increased its support to more communities and administers care to thousands of children and mothers living with HIV. All in all, the hospital has a 120-bed inpatient capacity, not including about 20 triage beds in the emergency room, which are almost always full. The sheer size and scope of St. Damien's programs is impressive enough, but the advanced technology it uses to care for its patients is almost unheard of in this country. One example is this digital X-ray machine, which allows physicians to consult with other medical experts around the globe and significantly reduces exposure to radiation. St. Damien has been a true port in the storm for Haiti's poorest families, somehow always finding a way to stretch resources and maintain a new standard of care. But the needs in this country just keep growing. Some 60% of Haitians have no access to even the most basic healthcare services, and the country continues to have the highest mortality rate in the Western Hemisphere for children under 5. Preventable conditions like malnutrition, diarrhea, malaria, respiratory infections, tuberculosis, and HIV/AIDS are the leading causes of death. While St. Damien has always been committed to treating Haiti's poor with an unprecedented standard of care, the numbers just keep increasing. Without a greater base of support for our programs, we run the risk of having to turn people away when they have no other options. People whose tenacity and strength are often their only resources.
It's absolutely amazing to me the drive of the people to push ahead in the face of so much sorrow and in front of obstacles which are so insurmountable, to still try to do the right thing for themselves and for their children. And that is a real heroic story. So we can only encourage people who are in a position to be generous to please don't forget us here. When your dollar comes to NPH, you can be sure it goes to good work.